So first, let's see about MTP. So MTP, medical termination of pregnancy. So what do you mean by medical termination of pregnancy? That is voluntarily, if we are terminating the pregnancy for so many reasons, that is called as medical termination of pregnancy, or else induced abortion, you can say. Okay, so generally, if you take in world, 45 to 50 million MTPs are performed per year. Okay, so that is 1/5 of total number of pregnancies happening is getting aborted. So in this line, you can expect questions. So how much abortions are carried out per year all over the world? 45 to 50 million MTPs. And if you consider the ratio, that is total, if 5 pregnancies are happening, in that one is getting aborted. So MTPs help to decrease the population. That is one advantage. But female feticide is also happening. Okay, so the only advantage of this MTP is we can avoid immature fetus. Okay, that is the babies, handicapped babies can be avoided, and other genetic disorders are there, means in the fetus itself we can identify and can be aborted. Okay, so these are the advantages of this induced abortions. So many countries, they are not legalized this induced abortion procedures due to some emotional, ethical, religious, like God has given this baby, we should not destroy this. But even that is, if there are any genetic disorders or any other mental disorders, again after giving birth, the child along with the parents all are going to suffer. Okay, so but in many countries it is not yet legalized, and so many social issues are also there. But government of India legalized this induced abortion in the year 1971. You can expect question. Okay, so with some strict conditions. So what are all the conditions they have to follow if they are selecting induced abortion after pregnancy? Means that is, it is illegal if female feticide is happening, because in many states in India, dowry system is there. So if they are having female children, many female children, for the parents it will be a burden, they are thinking like that. And again, that is now against the dowry system also, the act has been amended. Okay, so again, this was legalized in the year 1971, but the act has been amended in the year 2002. So please remember these two, 1971 and 2002. Okay, and under this act, please don't get confused. That is, it is legalized in 1971, and in Parliament, the act has been amended in 2002. Under this act, that is only up to 20 weeks with some terms and conditions, this induced abortion can be carried out. But generally, this medical termination of pregnancy is safer within 12 weeks. Within 12 weeks, it is safer. That is first trimester, first 3 months. If we are undergoing this induced abortion, that will be safer. So beyond that, it is risky. And again, what are the terms and conditions to be followed for this induced abortion? Means if that is baby or mother will be affected due to that pregnancy, they can go for this induced abortions. Okay, as I informed, like if the baby is having any mental disorders or handicapped or any chromosomal disorders are there, they can select induced abortions. And because of that pregnancy and parturition, if mother is getting affected, means that is also permissible for this induced abortions. Yeah, so what is the major importance of this MTP? That is to avoid unwanted pregnancy. One more thing, in rape cases. So in rape cases, unwanted coitus due to forceful sex, the pregnancies are happening. Okay, so for that also it is permissible. And it is essential in cases of where continuation of pregnancy could be harmful either to the mother or to the fetus or both. Okay, so as I told, you can expect question like the safer period for medical termination of pregnancy is up to 12 weeks of pregnancy. So again, second trimester, in second trimester, it is riskier. Yeah. So what are the problems related with medical termination of pregnancy if you see? So majority of the induced abortions are performed illegally. Why? That is unknowingly, if the pregnancy is happening and again already they are having too many children, they'll go for this MTP. But for that, again, even though the government is trying to create awareness about contraceptive methods, they are not willing to follow any of the contraceptive methods. So even after that, if they are getting pregnant, automatically they cannot do legally. Okay, so some are following illegal MTPs without any proper reasons, terms and conditions. Okay, so this misuse of amniocentesis. What do you mean by amniocentesis? That is, this is amniotic fluid, and that is an syringe will be injected, and the fluid, amniotic fluid, can be withdrawn, and with this amniotic fluid we can examine all. That is, sex can be determined, sex of fetus can be determined, and any disorders, chromosomal disorders, can be examined. Okay, so this amniocentesis we can use for the examination of disorders, if any, but many are using for detection of sex of the fetus. So if female fetus is there, many those who don't want to have female child, they will go for this medical termination of pregnancy, that is induced abortions. And if the fetus is female, automatically it is followed by MTP. So such practices are dangerous for young mother and fetus. Because, and again, if they are following only once, it is not an issue. So again and again, without taking any measures, contraceptive methods, contraceptive procedures, again and again, if pregnancies they are facing and going for MTPs, that will be very much dangerous for the mother also. Okay, so what is amniocentesis? Just withdrawing of amniotic fluid, okay, and analysis of fetal cells. So because in amniotic fluid, fetal cells will be there, okay, and some other dissolved substances also very much helpful to determine some of the disorders, genetic disorders. Okay, yeah. Yes, again, one more thing, as we discussed, one more act was amended in 2017. Okay, that is again only within first 12 weeks, if the MTPs are carrying out within this first trimester, within this 12 weeks of pregnancy, okay, only one medical practitioner is enough for carrying out this MTP. That is, we have to get the opinion of one medical practitioner, that is one doctor. And again, if they are finding out pregnancy only after fourth month, that is 12 to 24 weeks in second trimester. Okay, so after finding out any disorders or any other complications, if they have to go for MTP, they should get opinion from two doctors. Okay, see, two doctors. So again, from this concept also, you can expect questions. So within 12 weeks, opinion of one doctor is enough. And in second trimester, that is 12 to 24 weeks, two doctors' opinion is needed. Yeah, so that's all about medical termination of pregnancy. Okay, so here you have to remember what is the definition you should know. Voluntary termination of pregnancy or else induced abortion is called as medical termination of pregnancy. So this is always safer side if you are carrying out this MTP in first trimester. So all over the world, 45 to 50 million MTPs are performed. Okay, that is, if 5 pregnancies are there, in that 1 is getting aborted. And what is the major role of this MTP? It is very much helpful to decrease the population. Many countries have not legalized, but India legalized MTP in the year 1971. Act has been amended in 2002. Okay, so here under this act, which was amended in 2002, MTP, that is induced abortions, is permissible within 20 weeks with some terms and conditions. If the baby or mother will be affected because of that pregnancy, this can be carried out. And due to rape cases, if pregnancies are happening, it can be permissible. Okay, and again, it is safer side. It will be safer side in first trimester, and in the second trimester, if you are preferring this MTP, that is riskier. Okay, yeah. So what do you mean by amniocentesis? Just fetal cells will be collected by using a syringe, and again it can be examined. The sex of the fetus can be identified, and any of the chromosomal disorders, it can also be identified. And again, this is not legal. That is, identification of sex of the fetus is not legal. It is illegal. Doctors easily they can identify the sex even while doing scanning, but they should not disclose the sex of the fetus to the parents. Yes, that's all. That's all about medical termination of pregnancy. Okay, yeah. Next, sexually transmitted diseases. So what are these sexually transmitted diseases? Just very easily anybody can say about HIV, that is AIDS. Okay, not only this AIDS, so many diseases are there. Okay, so what do you mean by this STDs? That is, it can be transmitted through sexual intercourse. Okay, so this again the government tried so much to create awareness about this sexually transmitted diseases. Okay, and again, how the STDs are getting transmitted means only through sexual intercourse. But in AIDS, you might have heard, like by kissing, AIDS cannot be transmitted. But if any mouth ulcers are there, if any blood leakage is there in the mouth, definitely that will lead to AIDS. Okay, and again, apart from AIDS, venereal disease also, that is STI, reproductive tract infections and venereal diseases are also comes under this STDs. So there are so many: gonorrhea, syphilis, genital herpes, and again chlamydiasis, genital warts, trichomoniasis, hepatitis B, HIV, and even cervical cancer. So these all comes under this sexually transmitted diseases. Okay, and again, cervical cancer is also caused by this herpes simplex virus. So in this slide, I have given what are all the microorganisms which are responsible for different types of this sexually transmitted transmission of this sexually transmitted diseases. Okay, yeah. So first, gonorrhea. So gonorrhea, if you take Neisseria gonorrhea, it is a bacterium. And again, syphilis, if you take second disease, syphilis, it is again causative agent is Strychnoma pallidum. Third one, genital herpes or herpes simplex virus or HSV. So this is also causing cervical cancer. Cervical cancer, but it is not, cancer is not that is, it is not getting transmitted. But this herpes simplex virus can cause cervical cancer also. Next disease is chlamydiasis. So chlamydiasis, again, chlamydia trachomatis. Genital warts, human papilloma virus. So genital warts are caused by human papilloma virus. And trichomoniasis, Trichomonas vaginalis. Trichomonas vaginalis, and hepatitis B by hepatitis B virus. And human immunodeficiency virus leads to AIDS. So again, in this slide, you can expect matching questions. Gonorrhea, Neisseria gonorrhoeae bacterium, syphilis, Trypanosoma pallidum bacterium, and again genital herpes simplex virus, chlamydiasis, chlamydia trachomatis, genital warts, human papilloma virus, and trichomoniasis, trichomonas vaginalis, hepatitis B virus, and HIV, AIDS. Yeah. So in this, I think you might have heard what are all the measures to be taken for preventing this sexually transmitted diseases. So the sexually transmitted diseases can be avoided by using some of the contraceptive methods like condoms, okay, and avoiding sex with multiple partners, okay, and avoiding sex with unknown persons. Okay, and again, apart from sex, that is even HIV, if you take, it is getting transmitted in some other modes also. For example, blood transfusion. So if blood is getting transfused from the person who is infected with HIV, automatically it will be transmitted. And again, from mother to fetus also, from mother to fetus, and again, the sharing of injection needles. So while sharing the needles, again, if that needle was previously used for HIV infected person, automatically it will be getting transmitted. And the surgical instrument also, surgical instruments, sterilization is very much important. Sterilization is not proper. Sterilization is very much important. If it is not done properly, automatically that will also lead to transmission of HIV. Okay, so we have discussed so many STDs. In that, hepatitis B, again, you can expect question from this. Okay, so what are the diseases which are not curable? Hepatitis B, genital herpes, and HIV, genital herpes and HIV. So all other diseases, what we have discussed, like syphilis, genital warts, gonorrhea, everything can be treated if it is diagnosed at the early stage and treated properly. So here the problem is, even though if we are having any symptoms in our genitalia, we will, that is many of the persons, they won't go to the doctor because of shyness. Okay, it should not happen. Whenever we are having any kind of symptoms of these diseases, or else even though if you are not infected, if we go and consult a doctor, that is not an issue. But if we prolong, what will happen? Automatically multiplication of all these organisms will happen, and that will make the disease severe. Okay, and few of the symptoms, early symptoms are automatically, that is, itching will happen due to over secretion of fluids. But if it is intolerable, we are not able to tolerate that itching, and so much of fluid is getting discharged from female genitalia, and if you are always feeling some slight pain, and if we recognize some swellings in genital region, automatically we have to consult a doctor. So these are the early symptoms. Okay, so again, if we are not going, what will happen means automatically all the organisms, it will be getting all nutrients from our body, they'll get multiplied. Okay, and again, what will happen means that will lead to PID. Expansion is pelvic inflammatory disease. So pelvic region will get inflamed due to the accumulation and interference of these organisms into the cells which are present in those regions. Okay, and yeah, abortions. So abortions automatically, that is MTPs are induced abortions. So because of these many problems automatically. If we are not treating well, the couple, even though if they are getting pregnant, the baby will be aborted automatically, naturally. And stillbirths, what do you mean by this stillbirth? That is, stillbirth means again, gestation period is for 9 months. Gestation period is for 9 months, but immature baby will be delivered. Immature baby will be delivered earlier. That is called as stillbirths. And again, with some defects also. Ectopic pregnancies again, that is, pregnancy should happen in fallopian, fertilization should happen in fallopian tube, and after implantation, the baby should grow in uterus. But here in ectopic pregnancies, that is not followed properly. Okay, and again, infertility or cancer of the reproductive tract. So cancer of the reproductive tract means again cancer in vagina is possible, cancer in cervical region is possible, and again cancer in uterus, fallopian tube, ovary, anywhere cancer can happen. Okay, so we should not avoid consulting a doctor if we are having any early symptoms like itching, fluid discharge, pain, continuous pain, and swelling of genital region. Okay, and what is this absence or less significant early symptoms and the social stigma, that is infected persons to consult a doctor? What do you mean by this social stigma? That is again what they will be thinking, like if any diseases are getting identified, they will be, they have to live. All people will avoid them. So because of that, many won't go and check for, even if they are very well knowing they might be infected with HIV, because the persons, those who are having multiple sex, definitely if they are having all of these HIV symptoms, they'll become lean, and often they used to get cold and fever due to the immune system, defective immune system. These viruses again, they will interfere with the immune system of the infected person. So even after knowing the symptoms very well, they won't go and consult a doctor. And because of that, the spreading of diseases will also be more. Okay. Yeah. So how to prevent this sexually transmitted diseases? So as I told, avoid sex with unknown partners and multiple partners. Always use condoms during coitus. In case of doubt, please don't hesitate to go to a qualified doctor. So if we are detecting, if we are diagnosing early stage, so diagnosis is very much important. So if diagnosis is happening early, we can cure. We can cure any kind of diseases except genital herpes, HIV, hepatitis B. So these three are not curable. Okay, and again, it is not like I'm having very much immunity, I'm having strong physique, so I won't get any infection of any kind of viruses or bacteria which are causing this STDs. It is not like that. All persons are affected, can be affected because of these organisms. Okay, and again, these are very high among persons in the age group of 15 to 24 years. Again, this is important. Sexually transmitted diseases, at which age it is getting transmitted? 15 to 24 years, because they are not having that much awareness. For that only, government introduced this reproduction chapter and reproductive health chapter in higher studies, like in schooling itself. Okay, so to avoid sexually transmitted diseases, one should follow all these measures.